What if the cure was deadlier than the disease? For centuries, treatments like bloodletting and lobotomies caused more harm than good. These deadly practices were widely accepted despite their risks. History reveals shocking medical mistakes that shaped modern healthcare. Could some treatments today still be just as dangerous? Chapter 1. The Origins of Dangerous Medicine. Let's start in ancient times when medicine was often more dangerous than the diseases it aimed to cure. One of the most infamous treatments was bloodletting. The Egyptians, Greeks, and Romans believed that the human body contained four humors: blood, phlegm, black bile, and yellow bile, and that illness was caused by an imbalance. Blood was considered the dominant humor, so doctors thought excess blood would restore health. So, physicians used sharp instruments or leeches to drain blood from patients, sometimes removing astonishing amounts. This practice was so common that barbers doubled as surgeons, performing bloodletting alongside haircuts and tooth extractions. That's where the red and white barber pole comes from, the red representing blood and the white representing bandages. But bloodletting was often deadly. Excessive blood loss weakened patients, lowered immunity, and sometimes caused death. Even famous figures like King Charles II of England and George Washington were subjected to this treatment, which likely contributed to their decline. Chapter 2. The Age of Misguided Innovations. Next, let's move into the 18th and 19th centuries, a time sometimes called heroic medicine, because doctors believed in aggressive interventions to shock the body back to health. This era saw a surge of strange and risky treatments born from a mix of hope and ignorance. One bizarre example was tobacco smoke enemas. Medical practitioners believed that blowing tobacco smoke into the rectum could stimulate respiration and revive drowning victims. This treatment was widely used in Europe and America, even with the obvious risks of introducing toxic smoke into the body. Instead of saving lives, it often causes irritation or poisoning. Then there were milk transfusions. Before the discovery of blood types and safe transfusion techniques, doctors tried to replace human blood with milk, assuming it could serve as a substitute. This practice was not only ineffective but also dangerous, leading to severe reactions and deaths. Cocaine was another so-called wonder drug discovered in the late 19th century. It was used to treat everything from toothaches to hay fever and even as a local anesthetic. But no one understood its highly addictive nature and harmful side effects, leading to widespread misuse and serious health consequences. Chapter 3. Surgery before modern science. Let's talk about surgery before the late 1800s. Surgery was one of the most terrifying and dangerous medical procedures. Without anesthesia, patients had to endure unimaginable pain, while surgeons worked quickly to minimize suffering. Battlefield amputations during conflicts like the American Civil War were performed at a rapid pace, often with crude tools and no pain relief. But infections were the biggest killer. Surgeons did not understand the role of germs in spreading disease. Instruments were reused without sterilization, and surgeons operated with unwashed hands. Wounds often became infected with gangrene or sepsis, turning minor injuries into fatal conditions. The mortality rate for surgeries was staggering. Many patients died not from the injury itself, but from shock or infection afterward. The brutal reality of surgery during this period is a stark reminder of the importance of antiseptics and anesthesia, which only emerged in the late 19th century, revolutionizing surgical practice and saving countless lives. Chapter 4. The Dark Era of Psychiatric Treatments. Now, let's look at mental health treatments, which have a particularly grim history. One of the most notorious procedures was lobotomy, developed in the early 20th century. It was believed that severing connections in the brain's frontal lobes could alleviate symptoms of mental illnesses like schizophrenia, depression, and anxiety. The procedure often involves inserting a sharp instrument, sometimes an ice pick-like tool, through the eye socket to destroy brain tissue. While some patients showed reduced symptoms, many suffered devastating side effects, including severe cognitive impairment, personality changes, and even death. Thousands of patients underwent lobotomies, often without proper consent or understanding of the risks. The emotional and physical toll on patients and their families was enormous. The lobotomy era reflects how fear, stigma, and limited knowledge about mental illness led to cruel and irreversible treatments. Chapter 5. creepy but sometimes effective practices. However, not all unusual historical treatments were purely harmful. Some, due to their unsettling nature, had practical benefits and have even found a place in modern medicine. Maggot therapy, for example, involves placing live maggots on infected wounds. These maggots consume dead tissue, preventing infection and promoting healing. This practice dates back centuries and was used by indigenous peoples and early European doctors. After falling out of favor, maggot therapy has seen a resurgence in recent decades due to its effectiveness in treating chronic wounds resistant to antibiotics. Another ancient practice is trepanation, the drilling or scraping of holes in the skull. Used for over 7,000 years, trepanation aimed to relieve pressure inside the skull or treat neurological conditions like epilepsy. While it sounds horrifying, some patients did experience relief, suggesting that this crude surgery had a basis in practical observation. So, these treatments show that even in the darkest corners of medical history, there were glimmers of insight and progress. Medicine is often a complex mix of trial, error, and discovery. Chapter 6: Lessons Learned and Medical Progress. Looking back at these deadly and bizarre medical treatments, it's clear how far medicine has come. Many practices were based on limited knowledge, superstition, or desperation, often causing more harm than good. Yet, these painful lessons paved the way for modern medical science. The discovery of germ theory by Louis Pasteur and Robert Koch transformed how doctors understood infection. Joseph Lister's introduction of antiseptics drastically reduced surgical deaths. The development of anesthesia made surgery humane and feasible. Advances in pharmacology, medical ethics, and evidence-based practice have all contributed to safer, more effective treatments. But let's also reflect on the present. Medical science continues to evolve, and treatments once considered revolutionary may one day be seen as outdated or even harmful. Understanding the deadly mistakes of the past is essential to ensuring that the future of medicine prioritizes patient safety, ethical standards, and continuous learning. Looking back at these deadly medical treatments, it's clear how much medicine has evolved and how many lives were lost along the way. From bloodletting and lobotomies to toxic medicines and risky surgeries, history teaches us the importance of science, ethics, and continuous learning. It also makes you wonder, what treatments today might future generations look back on with disbelief? Medicine is always changing, and understanding the past helps us build a safer future. If you find this journey through medical history fascinating, don't forget to hit the like button and subscribe for deeper dives into the stories that shaped our world. Thanks for watching.